this time, we'll ask Larry Dorr to introduce this afternoon's keynote speaker.
See you in a minute. Good afternoon. 2.5 years ago, when I decided to return to school, become a nurse, I knew that I wanted to return to JCC. I called Kathy Dow, the nursing department chair, and I explained my situation and my desire to enter the nursing program for the fall, which was 2009. She sympathized with my story, but informed me that it was also the desire of many other students to enter the program for the fall. I had some classes I needed to do to be qualified to enter the program, and I did not get in for the fall. I then, like my other classmates, took the classes needed for the program and applied for the newly formed weekend nursing program. Kathy has an open door policy in her office, and this is a policy I'm sure she began to question. As I visited her at least once a week to express how much I wanted to be admitted into the weekend program, she was either going to get sick of my face or let me in the program. So I think a little bit of both happened. My persistence and hard work paid off, as did that of my fellow classmates as we were accepted into this weekend program beginning January of 2010. Over the last 2 years, Kathy Dow has been a guiding force in our class and has fulfilled many roles for us. She's been our counselor, our coach, our mentor, our therapist, and our teacher. Kathy believed in us when we didn't believe in ourselves. And when we had doubt, Kathy repeatedly told us, "You can do this." And that's a direct quote. She repeatedly said, at least I know in fact to me, "You can do this." And she was right. We did it. So it's our honor to prove you correct. In her career as a nurse, a manager, and instructor, Kathy has touched countless lives. And through us, she will touch countless more. This month, Kathy steps down as the chair of the nursing department and retires with her husband Tim to the sunny skies and temperate climate of Florida. This has been a special journey that our class has shared with Kathy, and now we leave GCC together. The weekend nursing class of 2011 would like to thank Kathy Dow for her tireless work to improve the nursing profession and our community. We thank you for helping prepare us for the careers we're about to begin. Kathy, you'll always be our teacher, and now we also consider you our friend. Ladies and gentlemen, Kathy Dow.
I was doing okay. I really want to thank the class of 2011 for inviting me to speak this afternoon. I kind of thought you would be tired of hearing my stories after the last 2 years. I'm definitely going to miss Larry stopping by my office just to chat and make sure I remembered his face. 24 months ago, these graduates took a chance. Thanks to a Department of Labor grant, Jefferson Community College was able to offer the opportunity to complete a nursing degree by attending class every other weekend for 24 months. Mr. David Scheer, a gentleman from Massachusetts with ties to Watertown, heard about this new venture, and he provided some funds to assist this group of students with tuitions and books and uniforms to give them a head start. So every other weekend sounds easy enough. I can assure you it was not. As inaugural members of the weekend program, they were mostly patient as we figured out how to make this idea a reality. And as Dr. McCoy said, we have learned much from you as well. The members of this first weekend scholar class have come here together from many different paths. Some of them were already in healthcare and wanted to further their careers. Some were changing careers completely and taking on new challenges. They belong to different generations and come from different parts of our nation. For some, the path has been direct. For others, a winding road. But these 10 graduates share one important goal: the desire to become a nurse. Over the course of the last 2 years, this class has shared great joy and also great sadness, but through it all, they have persevered in their determination to become a registered nurse. What is there about being a nurse that makes them want to work so hard to join this profession? During the 17th century Europe, nursing care was provided by men and women serving punishment. It was often associated with prostitutes and criminals serving time. They had a reputation for being drunk and obnoxious. It was not until Florence Nightingale, a well-educated woman from a wealthy family, became a nurse and improved it drastically that people began to accept nursing as a respectable profession. Florence defined nursing this way: nursing is an art, and if it is to be made an art, it requires an exclusive devotion, as hard a preparation as any painter's or sculptor's work. For what is the having to do with dead canvas or dead marble compared with having to do with the living body, the temple of God's Spirit? It is one of the fine arts. I almost said the finest of fine arts. We've come a great distance since Florence's time, but if we believe what we see on TV shows like Grey's Anatomy and Scrubs, nurses simply push stretchers, have romances in healthcare, and provide a human backdrop for the real action. The truth is, today's nurses are on the front lines of the healthcare delivery team. They assess and monitor patients, and taking a holistic approach, they determine what patients need to attain and preserve their health. Nurses provide care, and if needed, alert other healthcare professionals. Nurses coordinate care by physicians, nurse practitioners, social workers, physical therapists, and others. Nurses assess whether care is successful. If not, they create a different plan of action. Nurses are patient advocates, protecting the interest of patients when the patients themselves cannot. Nurses are educators, explaining procedures and treatments to patients, teaching them how to care for themselves and work towards full recovery. Hospital nurses are responsible for discharge planning, deciding together with other health professionals when patients are ready to go home. Nurses work to prevent illness through education and community programs designed to decrease transmittable illnesses, violence, obesity, and tobacco use, and provide maternal-child education, addressing some of the leading health problems of our time. Some nurses are independent scholars whose work is at the forefront of healthcare research. However, I believe it takes more than just the ability to calculate a medication dose, empty a wound vac, or recite normal lab values to be a great nurse. Don't get me wrong, all the science and technology that you have learned is a necessity to being a nurse. I just believe it takes something more. According to the Gallup's annual survey of professions, nursing is recognized as the most trusted profession in America. This honor comes from our commitment to honesty and high ethical standards. Trust in care providers is an essential element in reestablishing well-being lost due to illness. I think our job is a sacred one. Mother Teresa once said, "It's not how much you do, but how much love you put in the doing." I think that the art of healing is a privilege. It is one filled with love and compassion. Treat your patients with this love and compassion. Listen to that voice inside you. Let it guide every encounter you have. If you do this often enough, your job will take on entirely new meaning for you. Your words, your touch, your very presence will heal. The poet Maya Angelou is quoted as saying, "They may forget your name, but they will never forget how you made them feel." Your theoretical knowledge and technical skills will impress your supervisors, but your patients will remember the extra moment that you spent with them, that you looked them in the eye and cared for them with gentle hands. As you advance in your career, please do not lose sight of the reason you began this journey. Be proud that you are a nurse. I ask you to build alliances, not tear down others, and to speak up and speak out for nursing. Present yourself as a professional you are. As you transform today from my student to nurse colleague, I want you to know how proud I am of each and every one of you. You have all touched my life, and I wish for you a life filled with the knowledge that you make a difference in the lives of all you care for. Thank you, graduating nurses, for the legacy you leave behind and for all of the outstanding contributions that you are poised to make in the future.